if you're talking about prevention, let's start from the beginning then, right? Let's go in order then. So if we talk about the prevention of the COVID-19, the first thing, one word which is out there is, a term which is called social distancing. Okay. Now, I personally have a lot of problem with this word, because I feel it should be more like physically distancing and not socially distancing. I think we should be socially connected and physically distanced.
Okay.
Right? This is what I feel. Now, the thing is, like I had mentioned that, when an infected person, he sneezes, coughs or talks, the particles, the droplets are out in the air. And this way, it could land in the mouth or the nose of the other person and infect them. So it is very, very important that we maintain physical distancing. It is very important that we maintain, being away from crowded areas. So it is, please avoid gatherings. Please do not have guests over to your place. Do not have children coming over to your place to play with your kids, right? And like I mentioned that, the droplets, they tend to settle on the surfaces. So this makes the environmental cleaning and disinfection part very important. It is very important to clean your home frequently. So when we talk about disinfection, so in that, the hard surfaces, there have been reports, which say that, the virus probably, it could be on surfaces lasting several days. So it is important disinfection should be taking place frequently. So talking about hard surfaces, now there are these disinfectants which have been approved for use against the SARS-CoV-2, which have been approved by the EPA. Now, the EPA is the Environmental Protection Agency. Now, if you go to the site, there's a whole list of disinfectants which have been given over there, right? But then just to, if some people might find it a little complicated, I would just say that, whatever disinfectant you have at home, as per the instructions given there, just use that, so at least that should suffice, right?
Okay.
And then if talking about soft surfaces, so for example, floors and rugs and drapes, that according to the manufacturer's instructions, wash them, with the shampooing in the warm water, right? Talking about utensils, first of all, wear disposable gloves, wash them in hot water with just the normal dishwashing soap. So that is the environmental cleaning and disinfection. Then we come to the thing of hand hygiene. Okay. Now, hand hygiene, again, the person is coughing, sneezing, it reaches the surface, and now the hand is the first thing which goes and touches on the surface, and then it comes on, right? So very easily transmitted through the hands. So it is very important when a person coughs or sneezes, practice respiratory hygiene. So respiratory hygiene means sneeze or cough into the bend of your elbow like this, so that you don't spread it around, and also so that you don't have to use your hand, because hand is the first thing we tend to touch on the face. So practice respiratory hygiene. However, the most effective way to prevent the coronavirus infection is to simply just wash your hand with warm water and soap for a period of 20 seconds, or use an alcohol rub. Now, why I'm saying warm, you need to use warm water, that is because using warm water, it removes the oils from the hands, and the oil could be carrying those microorganisms. So that is why warm water.
All right, great. Good information. Very nice.